My dear listeners of Satrangi Rainbow, today we have invited Dr. Sira in our studio. He was born and brought up in Nairobi, Kenya, and was educated in the University of Birmingham for his degree in medicine, and remained a lecturer in the same university for 2 years. And in 1970, started practice as a general surgeon and family doctor. He has also remained president of Indian Immigrant Aid Society. Now he is enjoying his superannuated life, but still he is engaged in volunteer activities and has even visited India a couple times in Indian hospitals for the same purpose, like volunteer as a volunteer, he has provided his services. So, Dr. Sira, I welcome you to our program and please guide our audience from your vast experience.
Oh, thank you for the invitation. Yes, I will try.
Dr.
Today
Sira, as everybody knows, that our body is made of cells. And
you're right.
how do the, and why, and how do these viruses attack the human body?
Yes, certainly we can discuss that. As you probably mentioned just now, that our body is made up of cells, and altogether there are about 30 trillion cells. Now, that, as you know, is a vast number. Uh, in addition to all these cells in our body, we are also harboring other microorganisms. Now, these live on our skin, in our mouth, in our ears, nose, in our gut primarily. And they are a large number also. It's like more like 50 trillion cells.
Oh my God. So
Well,
many.
well, exactly. Well, 50, not cells, but organisms. That includes bacteria, viruses, fungi, and various other microorganisms known as biome. Uh, this is our body has uh, got accustomed to them, and they live quite happily, and we use them all day and every day. Um, so if you look at it, we are only about 43% that we are. The rest is all microorganisms. So, uh, so these are the bacteria and viruses, as I've said. Uh, and how do we know this? Well, it's a technique. We collect the feces, for example, and do an estimation, a DNA estimation as to what's in there. Now, let you know that there are about 2,000 varieties of bacteria that live in our gut, and they've been living there from day one till the moment we, die. So, and they do all kinds of services for us. Uh, each of our cells contains about 20,000 genes. Now, genes, as you know, in addition to the genes, our genes, we have the bacterial genes that we have to count. And altogether, we are dealing with about 20 million different genes all at once at any one time. So you can tell that we are in a uh, uh, in an environment with microbes and viruses and everything else around us. Today we are talking about the coronavirus, for example. Uh, there, there is a big debate whether the virus is a living being or an inanimate object. But that's a debate that we'll leave for another day because it's quite involved.
Right.
Uh, as you probably know, the coronavirus has been living in the bat population for a long time, and they don't seem to mind the presence of the coronavirus in the bat. They're very happy with the situation. Now, viruses, come in all shapes and sizes. The coronavirus itself is a sphere, but there are also cylinders and rods, and you name it, there's a shape. How big is the virus? Well, the virus is about 100 microns. Now, that's a very small virus. You need an electron microscope to view it. The coronavirus is so named because of projections of proteins from its surface, and these are called the S proteins. Uh, and these proteins are the virus uses these proteins to attach itself to our cells. Um, Inside the virus itself, there are three proteins called M, N, and E. Uh, and the genetic code of the virus itself is in the RNA, which is within the virus. As you can tell, this is a complicated piece of machinery.
Right, sir. So, Dr. Sira, this is all medical jargon. It is very
Yes.
significant, though. But for a layman like me, how would you like to explain the coronavirus, which hit a couple years back the whole society? So, and it intrigued our society. So, what was it like in common terminology?
Well, the let me explain how it works. The virus itself is on a contact on a has come from the bats onto the humans. Normally it doesn't, but it gets inhaled. Okay, usually and lands into the airways, ends up in the lung tissue, and from there it finds its way into the cells. So this is a respiratory virus, so it ends up into the respiratory system, but also it attacks other cells. For example, the gut cells, the cardiac cell, and kidney cells, for example.
Right,
Now, what happens to the cell itself? The cell uh, is the structure of the cell is taken over by the virus, and the virus from then on takes control of the mechanism where the cell can regenerate itself, and the infected cells begin to manufacture the virus. Again, the details are kind of complicated, but in general, the genetic information of the virus has got itself so trained so it can take over the cell, the replication process, and it reproduces itself within the cell.
right,
As a result, the cell dies. Now, as the cell dies, it sends out signals to the host. And one of the ways of this is by sending a protein called interferon. And this interferon is the start, and it mobilizes the body's defense mechanisms. And this is where the immune response comes into being. And depending on how well your response is, it determines the outcome of the infection. The We can go into the defense mechanisms, or we can again, it's kind of detailed and a lot of technical jargon is involved. But the virus itself has also developed mechanisms so it can fool the normal response of the body. So this is an answer to your question just now as to
Right.
how it got where it did. Now, for example, the corona part of the viruses covers itself with some sugar material, so the body thinks it's part of the body. So the body gets fooled, and it doesn't stop. In fact, this virus is a very clever virus. When it replicates, it changes. In other words, this is when we are dealing with new variants, and these changes are very minor, so the body gets fooled into thinking that we're dealing with something quite normal. Now, how does you might ask, how do we deal with the situation?
Right,
Well,
sir. And what role the vaccination, uh, what role did they play? And
yes,
how do they conquer this virus?
yes. Again, the details of this response by the body is complicated, but in general terms, the body has got a defense system, and based on a response initially in the bloodstream itself, cells called macrophages, and these attempt to mop up any viruses. And this is and slowly other cells are mobilized for the in the immune response. The B cells and the T cells. Now these take a little longer. So from the it takes about 10 hours for the infection to start and for the response to be mounted. So now in that period, the uh, the vaccines or the immune response deals with the virus in several ways. Um, One way is to mop up the virus and attempt to overcome its the onslaught. And often the patient at this time is either in a state of recovery or may succumb. Now, and the body's defenses can be either to kill the virus or the response, immune response itself can be quite overwhelming. So some of the damage is caused by the virus, and some of the damage is caused by the immune response itself.
And it changes from one patient to the other.
It does. It does. It does.
A little while ago, Dr. Sira, you were talking about the replication of the virus.
Yes.
So when it gets replicated, then the same vaccine, how does it address that situation?
Well, So let me begin you by telling you what the vaccines, how the vaccines are made. What there are several types of vaccines. Have the Moderna, the Pfizer, and what they do is they take up bits of the virus and use some of the proteins and produce antibodies for those, and those are injected into the body so that when the body if you have had the vaccine inside you, then the body is ready to mount a response because you already have, there is a template inside you telling, okay, there's a new infection around, please mount defense here. And
Right,
the body is already geared for producing antibodies to in a way to deal with the onslaught of the virus.
right, sir.
So, and there are other types of vaccine. There are also some drugs which actually do kill the virus, but if the number is the virus number is in millions and millions, and the drugs cannot take care of all the uh, infective agents.
Right. Do those people who drink and those people who don't, is there some difference which that vaccination makes on them?
Well, I don't think drink itself is. I think it's more of a question of your immune status. You know how old you are and how developed your immune status is. The younger you are, the more robust. The older you are, the less likely you'll respond any viral onslaught. So that's the reason why you find older people succumbing and not recovering, whereas a young person may get the full blown infection, but the response is enough to take care of any virus that's floating around.
Right, sir.
So, what happens is that it's not only the virus itself that's the sheer numbers of the virus that's inside you. The immune response that is mounted can also be a cause of the problem. So we're not sure as to what the contribution is in the people who have scummed, but I don't know. There's been some estimates like in America alone, there were about 15 million people who had complications, not from the virus, but from the immune response itself. And these are, and particularly the nervous system is being affected in these people. And when I say nervous system, they experience, fatigue, experience memory losses, and also some organs are affected. And for example, the heart muscle, the the heart muscle is people have known to just drop dead for no reason at all. So
Right.
these are some of the problems that we are facing.
So, Dr. Sira, what I have noted is, what I have observed is that most of the people who got vaccinated against this coronavirus, and after a couple of years, you can say that they are experiencing some new situations, like some are harboring misapprehensions, maybe that it is due to those vaccinations. Blood pressure, high blood pressure, low blood pressure, or the cardiac arrest, or there are some significant changes in their immune system, and they attribute it to this COVID vaccination. What is your opinion about it?
I think the jury is still out as to who is to blame primarily for these complications. Uh, the virus itself, if it hasn't been proved fatal, then people, younger people usually recover from the virus. Okay, now they may have complications like we discussed. Some are quite severe and some not so severe, some mild fever or something like that for a day or so. But older people, again, same thing. Uh, they recover and go on with no complications at all. Now, then there are those people who have complications. We can discuss those, and those are the reasons for the apprehension and need for further work as to what is going on. Like I said, the jury is still out, but the vast majority of people who are vaccinated are they are better able to cope with an infection of a virus, whether it's a variant or a new virus, or old virus or the new variant. So, in answer to your question, should I get vaccinated? Yes, depending on how old you are. The older you are, all the more reason. Now, for example, the latest coronavirus vaccine is I think it's called the XXB, I think, yes. And now, this is number, I don't know, it's an Omicron variant. And this is what's being, people are being inoculated with now. Now, but it doesn't mean that you are fully protected. I think you're protected. You may get an infection, uh, and you'll be well prepared, at least immunologically, to deal with it.
All right. There is again another apprehension among the public that because of the booster doses of vaccinations against coronavirus, that is playing havoc with their health. What is your idea about it?
Well, I can only repeat and say that we're dealing with a virus which is. If you compare that with, for example, the influenza virus about 12,000 bases. The coronavirus is 29,000 bases or 30,000 bases. Now, the difference between 12 and 29 is quite huge, which means the coronavirus is able to produce much more or many more variants, okay, all at once. Whereas the influenza virus, as you know from years of experience, is able to produce variants, but they are not as lethal as some of the other viruses. So we we are better served by a vaccine than if you had no vaccine at all,
All right.
in my opinion.
All right.
Yes.
Is it going as a layman? I was wondering at whether these booster doses or the vaccinations should be treated the same way as we are getting flu shots every year.
Absolutely. I don't think there's any hesitation in recommending that you should get vaccinated, and if if you are in that age group where your immunity needs to be boosted, yes,
So it is going to be every day, every year ritual.
yes, unfortunately.
So, Dr. Sira, uh, recently I was watching on the net a speech delivered by no less than a cardiologist, and his name is Peter McCullough, and he was addressing European Union Parliament, and he delivered a long speech against the vaccination, which was administered for addressing coronavirus. And I don't know how far he is correct or incorrect in his observation, but he underlies the fact that there is a syndicate, inverted commas, syndicate, and then in inverted commas closed. According to him, there was a syndicate, and that was in the collusion or inclusion of what he says, I quote, Gates Foundation, United Nations, World Economic Forum, CDC, FDR, uh, grouping of non governmental agencies, unquote. So he says that there was no necessity of vaccination as such, but it has generated a lot of money in the pockets of those vested interests. What are your opinions, sir?
Yes, I saw the report. I think it is an interesting report. Unfortunately, as you know, some of these is based on the evidence which actually does not support, because he was using figure or death figures or people who had succumbed, and these were not necessarily due to the uh, complications of the vaccination. I mean, these were people who had died for various reasons who happened to receive the vaccination. They would have died anyway. In other words, it's not a clear cut one to one relationship as to, you had a vaccine and you dropped dead. No, I don't think it's that. And I don't think this was the reason why his reports were not published in any reputable journals which serve the medical community.
Right.
So, although he had the European Union gave him a platform to air his views, and he's welcome to his ideas and views. As far as there is, as you know, as you also mentioned, there is a lot of money involved in the various manufacturers of vaccines when they export them and sell them naturally. So there is also a vested interest by these companies. Uh, so, but everything costs money. If you produce a vaccine and you have to deliver it, it costs money. So there is a certain amount of expense involved in the delivery of the vaccine. As far as whether you need it or you should have it,
Yeah.
now that's entirely up to you. And on the medical evidence that we have with regard to these virus infections, not only corona, but we can mention polio, we can mention measles, we can mention any number of them. Okay. And they all have one thing in common. We know from experience that all these diseases caused by these very respective viruses, the death toll from these has reduced over the years. No,
You're right.
no question, no question about that.
You are right.
So,
You are right.
so if someone comes along and say that vaccine is not needed or not useful, or no, he is not uh, stating the facts as they are. So that's my response to those claims. Again, to repeat, the evidence points that vaccines are helpful. Now, there are questions about uh, other outcomes which are not necessarily associated with the vaccine, but we're not sure as to what those causes are, and because it's still not completely evaluated as to what the virus and the immune response does. So there's the balance as to which is more troublesome.
You are right when you say that the vaccines they have been quite helpful, quite useful in combating so many diseases. But his speech, I don't know why I'm repeating that. That his speech pertained particularly to the vaccination against coronavirus.
Yeah, well, I think he had some vested interests as to why. I don't want to go into it, but
Right, right, right. We shouldn't. Yes, yes, you are right. So, more or less, that has to be an annual feature and ritual to get vaccinated against coronavirus from now
unfortunately,
onwards.
unfortunately, yes.
Okay. And is there some another way that some people they want to know that what are the other measures which should be taken up by the sufferers or would be sufferers?
Yes, I think again measures that one takes, for example, masking and avoiding large crowds where not everybody is vaccinated and they are harboring the virus and disseminating it. So these are the precautions that one takes, and that applies to everything else. Make sure your hands are clean, you wash, all the rituals that we undertake to uh, uh, stay away from being infected. So these are important parts. In fact, I would say they're even more important than the vaccine itself. To avoid contact where, or if you have it, to make sure that you wash clean at all times and avoid undue contact where it's not necessary.
All right. Uh, we don't want to forecast any tragic situation, but still, my mind sometimes is agitated that whether the same type of situation which arose after COVID 19 spread of that disease, will it be, can it be repeated?
Well, yeah, I cannot forecast as to what the new viruses may come about, but yes, it is. Of course, it is.
We don't want that it should be repeated. But
Yeah, we don't.
is there any chance or
Yeah, it can happen.
so that is unfortunate.
This is unfortunate.
Yeah.
Yes.
Dr. Sira, I'm really thankful to you for your valuable pieces of advice. And you have, to a larger degree, dispelled the fears and the misapprehensions which some people they were harboring regarding this vaccination against coronavirus. So I am really grateful to you, and I would like to invite you to my channel again to learn from you and on a variety of medical tips which you have provided. So we would look forward to hear from you other tips and other tricks you can say to fight against the viruses, and your wealth of experience will go a long way in addressing the issues of the patients which they most of the times they don't have any platform to go to, instead of just kowtowing to the views which are generated on social media.
Yes, and unfortunately, that is the situation. So, my general advice would be that each and every one of you should consult your medical practitioner as to what should be done. Should I get in, do this or that or not do this? So they are in the best position as opposed to your neighbor or your friend and so on. I mean, they can give you medical advice you can take, but I think the professional advice is probably the best for you. I think in
You're right, sir. But we will be banking upon, we will be depending on your medical advice in future. So
that's very
thanks very much, sir.
you're most
Thanks, Dr. Sira, for your valuable time.
you're
And
most
I would like to invite you, as I said, again on this channel. Thank so much, sir.
thank
Thanks for your time.
thank you very
Thanks.
much.